started now. Great. So, welcome. Welcome, everyone. I really appreciate that you've hung in there for a little while we've sorted this all out. And sorry, formally welcome you. I want to formally welcome you to the call, and let's go ahead and ensure that the rest of technology agrees with us for the remainder of the time that we are here together. So, very quick welcome to everyone from across Ontario who I know is joining us here this morning. Thank you for joining us, and I'll go ahead and talk about the handouts in just a second. So, you here for the Recognizing and Responding to Intimate Partner Violence for RAP Centers, Ontario RAP Centers, and on behalf of Rexdale Women's Centre and our funders, the IRCC, we formally welcome you. And again, thank you for hanging in there with the technical difficulties this morning. So a quick introduction to myself. My name is Carol Soares. I'm a registered social worker, consultant, and was the project coordinator for the Advancing Recognition and Response to Intimate Partner Violence for RAP Centers. And so the project primary website is the rapworkers.com platform, where all of the training, resources, tools, some of which we'll be referring to today, will be all housed that you can go to at your leisure and take the training and continue to access all the tools and resources that are there. So the mission of the project has been to advance the capacity of resettlement assistance programs in Ontario as they identify and respond to incidents of abuse experienced by refugee women. And our primary objective was to expand the sector's existing knowledge base and to strengthen its capacity on a frontline staff, management, organization, and sector-wide basis. Partners for this project, including the primary lead agency, Rexdale Women's Centre, who partnered with CREVAC, the Centre for Research and Education on Violence Against Women and Children, and OCASI, the Ontario Council of Agencies Serving Immigrants, to develop the content, the materials, adapted existing materials for the specific target group and ensured sectoral representation. Of course, we've had a wonderful advisory committee, many of which had representatives from your agencies across Ontario, as well as our partner agencies. And so who's this webinar for today? This is one of two, and so this webinar is for possibly senior managers. You might be the person who's in the role of the organization and development of a protocol, or you might be someone who's been designated or an advocate or someone else within a resettlement or settlement agency who's been assigned to assume this role or coordinate maybe a partnership or a committee to develop the protocol. And perhaps you're someone who also recognizes the need and like to propose the development of a protocol that maybe that there's not something in place yet. It hasn't been something that has been started, but you recognize the need and maybe want to take this information back and sort of advocate for proposing that it be something undertaken by your agency. So what to expect? So you will find that this is a webinar. You're accessing it from all different means. Some of you may just be listening in by phone. Others are online and watching the webinar with slides. And there are some handouts. There are 3 handouts there. We'll be together for about 60 minutes, still 60 minutes. And I know that if you need to get off earlier, please do access the recording that will be sent out to everyone. And so the topic for this webinar is developing your organization's protocol for recognizing, responding, and referring refugee women and their families when intimate partner violence is witnessed, suspected, and or disclosed. And so here's just an overview of the agenda, what we'll be covering for this hour. So we'll be talking about why it's important to have a protocol. We'll touch on what stands in the way. We'll review the project protocol document, which is handout number 1. And so we'll go through that. If you haven't had a chance to look at that yet, you'll find the handouts that are there attached to this webinar. You will also find that handout is already posted on the rapworkers.com website as well. We will then move into looking at a new document that was developed. This is the protocol preparation key elements, kind of a checklist. And so that's handout number 2. We'll be going through that, and we'll also be going through a second new document, which is the protocol development outline, which actually walks an organization through that developmental process. We'll talk about how to get started if that's relevant for you today. We will take a look at some knowledge exchange and partnerships, bringing that up as a possibility, and then we should have some time for some questions and answers. So are you ready? After a little bit of the technical difficulties, and we are ready to get started. So I invite you, I know that most of you are at work. If possible, minimize the distractions that might be around you. Access the handouts. As I mentioned, there are 3. Be ready to take some notes and prepare any questions that you may have for that period of time at the end. Okay. So let's talk about, why is a protocol needed? Well, a protocol is needed, and some of you may already recognize this, and that's why you're here today, but a protocol helps to ensure that intimate partner violence issues are safely and consistently identified and addressed within an organization. A protocol also helps to ensure that appropriate supports and safeguards are in place for individuals and families dealing with intimate partner violence. And a protocol also provides a responsive, holistic, quality-driven service for refugee women and, of course, their families. And so the benefits are, so many benefits to the agency in terms of just clarity. People know there's no confusion about what to do in these circumstances. There's some liability issues that are addressed when you have a protocol. Benefits, obviously, to the woman in terms of safety, well-being, her potential, all of those things. Benefits to children for the same reasons, safety, their well-being. Benefit also to partners who, they may have an opportunity when there is a protocol in place to be held not only accountable, but to be offered resources and support information for them to address their behavior. And of course, the communities that these families are settling in, we all benefit as well. What are some of the barriers? What stands in the way of people having protocols? And so some of them include time. We're all busy. You work at organizations where there are so many things that are happening just on a day-to-day, minute-by-minute basis. And so time can be an issue in terms of why people haven't developed a protocol yet. Funding could also be an issue. It may be a lack of awareness around issues related to intimate partner violence. It may not be considered because it's a settlement agency. Maybe it's not considered the priority for the women and the families that you are seeing in your agency. And sometimes it might be just a lack of skills, knowledge, or resources that people feel would equip them to create this protocol. And so just think about for a moment, if you have not already developed a protocol, or it's been sitting and it's not really being implemented and adhered to, what are some of those barriers? What's been standing in the way of you having that protocol in place? All right, so let's take a look at the first document, and it's up to you if you'd like to follow along. That's fine. Otherwise, please make sure you do access it, whether it be here or on the rapworkers.com website. But I do want to just touch on what we've covered in that protocol document. It was a 32-page document, and so we know that it's lengthy and it's maybe difficult to sort of pull out everything that you would need in creating your own document. So just going to highlight some of the things that were covered in there. Was a framework, and of course it outlined items, activities, and actions that needed to be undertaken by RAP centers in creating their own protocol. And some people asked, if it couldn't be, a document that just specified everything they needed to know, that they could just kind of just start using. And while there are many things that agencies can take out and apply directly to their own document, there's similarities, of course, that exist across communities and initiatives, but we know, and you know, that there are significant variations related to participant demographics, key project partners, referral and referring agencies, services provided, and current intimate partner violence policies and practices within your specific settlement or resettlement agency. And so those variations affect how an agency might approach assessing intimate partner violence, and then, of course, how they're going to respond when it's disclosed or detected. So therefore, intimate partner violence, the protocol development by each agency has to be site-specific and tailored to reflect the particular characteristics of the community, and the specific programs and staff that are there. So here's what we covered in that document. We talked about some primary recommendations. We offered a framework for the protocol. We talked about challenges for women refugees, and we put that in kind of a cultural context. We talked about considerations and activities for the various stages. So, recognition stage, the responding stage, and the referral stage. We highlighted some safety planning and threat assessment tools. We talked about some key practice strategies, and we summarized those. And then we included a intimate partner violence policy statement. So some of the recommendations were, there were 4 in particular, and so we called upon all agencies providing services to refugee women and their families to adopt a clearly defined position and develop processes to support the safety of women from a holistic, client-centered perspective. The second recommendation was that we encouraged all management and direct service providers to be adequately trained to recognize the signs of intimate partner violence and to know when their intervention is appropriate and when outside intervention is necessary. Third, we urged all resettlement service providers or programs to establish a strategic plan that addresses the unique needs of women, and that these plans are guided by feedback from women and reviewed and or revised consistently. And finally, we invited all resettlement service agencies to support legislation that will help protect survivors of intimate partner violence and their children. So those are the recommendations. And just to highlight some of the concepts and information that we provided within the framework, we said that gender-based violence is obviously by no means unique to refugee communities. We said that women refugees experience unique barriers and often have distinct histories that require specific considerations. And we highlighted the additional complexities that create profound and intersecting barriers for women attempting to flee violence and make the issue especially challenging for service providers to address. We emphasize that RAP Center service providers aren't required to conduct a comprehensive intimate partner violence risk assessment, and we also said that they more than likely should not be doing so without the appropriate training and experience. But of course, we've said that under certain laws and professional code of ethics, as you know, that service providers are responsible for screening and responding to obvious signs of disclosures or witnessing related to intimate partner violence. And then we also just highlighted that collaborating with community experts is appropriate in many of these cases. And so finally, in terms of the framework, we said that by developing a protocol, RAP centers will be equipped with the knowledge and confidence to act in accordance within their legal competencies and duties in order to promote safety for all clients, as well as that perpetrator accountability. And then we provided a cultural context. And so we highlighted that Services must take into account a refugee woman's cultural context and how she views herself within that reality. We said that frontline workers will often unknowingly bring their own unique cultural values and beliefs to dialogues with refugee women. For example, there might be a belief that she should leave her partner, while others maybe don't address the concerns and offer a response, possibly based on a belief that she should just remain in that situation. And so, a quote from a journal article: family structure, acculturation, immigrant status, community response, and histories of oppression affect experiences of women from minority communities, and therefore, culturally congruent approaches for dealing with abuse will be most effective in response to incidents of intimate partner violence. And so RAP Center protocols will need to acknowledge that refugee women have multiple concerns that affect the decisions that they will make. Yet at the same time, need to be able to strive to develop actions that are consistent and responsive. All right, so the project protocol broke down many of the activities and recommendations for a response and procedures into the various stages and areas. And so we started off in terms of the recognition, identification stage, and in that section we referenced the resource guide that the project has developed, and again, it can be found at the ratworkers.com website, and also obviously all of the information, training, and tools that are found at that website as well. And so an example of what was highlighted in the early recognition, identification stage was that when violence is suspected and a service provider is seeking greater understanding, that conducting that interview without the presence of the partner or the accused perpetrator, or perhaps even other family members in some cases, can encourage that client or that woman to speak more openly. And that's just an example of something to be considered in terms of what will be that process. And then within that area, the recognition area, that initial stage, we talked about documentation and confidentiality considerations. And then the respond phase, so what you are doing in response to something that's been witnessed, disclosed. So in that area, we talked about some challenges related to early intervention and response. We talked about considerations when there is an immediate threat of violence, and so it's been witnessed or disclosed. What do you need to do at that time in terms of that person being at immediate and possibly significant risk? In that section, we referred to tools and other reference sources that would be useful for your organization at that response stage. And then the referral stage. And so within the project protocol, we talked about collaboration being very important in that stage in terms of what you will be outlining in your protocol. We talked about limits to service capacity and being able to clearly outline them, and under what circumstances will that referral or consultation occur. We talked about a multi-sectoral approach to identifying and responding to intimate partner violence. We also talked about referrals being very important and what to consider in terms of referrals. We highlighted legal considerations and responses that are available possibly to women who may disclose or have been a witness to experience intimate partner violence. And then, of course, we talked about community development related to intimate partner violence. And so examples might include outreach and education with other agencies. It might include organizing, mobilization, and accountability. So within the protocol, we also talked about safety planning and threat assessment tools. And so we highlighted some some important things to consider. We provided links and sources that are important for protocol activities. We provided a summary of the key practice strategies. And of course, I mean, this is just an overview of some things to consider as you're developing your protocol in detail. And so some of these included creating a safe space and building that rapport, maintaining awareness regarding signs, warning signs, and identification questions, so that screening stage, assessing risk, planning for safety, providing relevant information to that individual, respecting their self-determination and rights to make decisions, upholding confidentiality, and of course, where that's applicable and limitations to that. We've talked about referring and collaborating. Another key practice strategy to consider is to provide that ongoing support and follow-up to someone. You know, once they've been referred or connected with another resource, then what's your process within your agency to follow up and to continue to offer the settlement services or to just provide support based on, you know, what they might have disclosed to you? Who will that be? Of course, considering and making sure that you are evaluating service and intervention practices consistently and all along the way, and developing partnerships and advocacy initiatives. So we had a policy statement, and this was something that was developed by the working group and was applicable and encouraged to be adopted by all Ontario RAP centres. And this is just a couple of key highlights from that. So to support efforts to improve the rights, safety, and well-being of all refugee women utilizing resettlement assistance services in Ontario. And so we called upon all Ontario RAP centres to do that. And we said that we believe that the highest quality of services is an essential and non-negotiable element of resettlement services, and that refugee women can only receive this level of service when she is seen from a holistic perspective, including a broad range of potential vulnerabilities and experiences. And again, we called on all RAP centers to adopt this policy statement. All right, so that's just sort of an overview of the document, the project protocol. Again, I would invite you to make sure that you get a chance to review it in greater detail and use it to shape your protocol within your agency. And so what I want to do is move on to the other two documents that were created specifically for agencies to just, get that process started, to get things into motion. And so the first one is a protocol preparation key element checklist. And so this is just a single-page document, and it really is a way for agencies to think about, as they're approaching the protocol development process, what is it that we'll need to pull together? What will we need to know and identify in preparation for the protocol development? Obviously, there are all the details that I've started to highlight, and we'll go into greater detail as we look at the outline. But just in terms of allotting time, resources, information that needs to be gathered, knowledge that needs to be applied to this effort, what are the things that we'll need to consider just in the preparation stage? All right, and so I'll just go through the checklist here, and this will give you an idea, if you haven't already engaged in this preparation stage or the protocol development process at all. Here's some things for you to consider. So the first one is, what is the primary scope and purpose of the intimate partner violence protocol? Then, what are our core principles and values related to intimate partner violence? Next, what are the main programs involved in the service delivery process? So what are the programs that we'll likely see or be involved in or engaged and interact with these women or their families? Who are the key service providers and what are their main roles in the service delivery process or intervention process? How is intimate partner violence defined? And how does it usually or could present within your particular organization? And then starting to look at each area, how will we screen and identify intimate partner violence? How will we respond to intimate partner violence? Who will we consult with and or refer to in cases of intimate partner violence? And you may already have a sense of people that you refer to, or perhaps this is, some information gathering that you'll need, as you're pulling together that document. And then what are the confidentiality and reporting considerations that you'll need to think about? And then finally, what are the training and supervision needs of the staff involved? Staff involved in your agency, but specifically those who might likely, see, hear about, or reporting intimate partner violence or anything related to that. Okay, so this is just sort of a quick list. It's a checklist as you are getting started, gathering information, and perhaps it might guide you and, form the members of a committee. It might inform who would be around the table in discussing this if it's going to be a collaboration. And you'll know what type of information and resources you'll need to pull together in order to formally engage in this process. All right, so that's the checklist. That's the handout. If you have not already downloaded that, you can feel free to go ahead and do that. And we will also be adding that to the rapworkers.com website. Okay. All right, so let's go ahead and look at the protocol development outline. And so this is, again, this is our third handout. And so I would encourage you to, at your leisure, to print it out, to use it as your plan and to actually structure your protocol. It really just provides that whole framework for you to start putting things together. And so these things will be, information that you have taken directly from the project protocol document. These will be things that you may have already in place that are applicable to this intimate partner violence protocol specifically. And it will also be further developed for this particular process. Okay, and so let me just go through it. It's a 7-page document, and by 7 pages, it's not 7 pages of information. It's 7 pages spaced out so that you can actually take notes and start to, draft your protocol. You can actually start putting in the information that you will be putting into each one of these sections. And while it is 7 pages and it does provide the key areas, you may want to shape it, edit it, add things, remove things, and so make it your own. But this is really going to give you a great opportunity to get things started. All right, and so the first part is you may start your protocol with an introduction and a background. And so introduction and background, kind of self-explanatory, but the questions you'll be asking at that stage will be, why is this protocol being developed? What is the scope and role that it will encompass within your agency? And then there may be a little bit more of a background that's specific to your, your community or your particular, program as well. Okay, and you may want to provide a little bit of context there. And then the next section would be around your purpose and objectives. related to the protocol. So what are the needs, concerns, and issues that the protocol will address? What will the protocol accomplish, and how will it do this? Those are some of the things that you'll be putting in that purpose and objective. And you'll be really talking about, what is it that your protocol will be hoping to accomplish? So some of the words you might be using are to help, to promote, to strengthen, that kind of thing. Um, and then you want to be very clear about the role that it's going to be assuming, right? And so building on the introduction and background, you're going to start off by saying this protocol is designed to ensure that intimate partner violence issues, or, this protocol will be used to identify and inform staff and volunteer of, training needs, responses, that kind of thing, approaches, screening and assessment approaches, those kinds of things. So that's what is going to be important to highlight in the area of purpose and objectives. And then the next section is statement of principles. And so some of the questions that you'll be asking will be, what does your organization stand for, which supports the development and adherence to this document? What are the beliefs and core values related to intimate partner violence? And, I think it's really important that if you're doing it as an organization, it will be your organization's core values. Sometimes people, engage in this as a partnership, and so helping to identify shared principles and values are going to be very important. And so it may be similar to, those the policy statements that I refer to in our documents. And we recognize that intimate partner violence is a complex problem, et cetera, and that there's serious obstacles, that kind of thing. And you may say that you recognize that diversity in the, the refugee women and their families, that kind of thing. So you're going to really be outlining what are your main principles that really inform and guide the development and adherence to this document. Okay? And then the next section is the programs and services involved. And so what are the services involved where there could be witnessed and or reported incidents of intimate partner violence experienced by refugee women? And so it's important that you're able to identify every, stage that may encounter or may need to screen and identify these issues. Okay? All right, and so once you have done that, then you're going to be looking more specifically at what are the actual staff and their roles. And some of the questions you'll be asking will be, who are the parties involved at all stages of the intimate partner violence recognition, response, and referral process? And in what way are they involved? And then what's expected from each person? How will they respond? Who will they turn to or consult with? And then looking at what are their training and support needs for the staff who are involved at many different stages and phases. Okay, so that's the staff and the roles piece. And then, it's up to you how you choose to organize your protocol. But we've sort of broken it down to that initial stage, which I think is a nice way to frame everything. But so looking at the beginning recognition, screening, and identification phase, and what are the specific activities that will be involved there? What are the expectations at that stage? So the questions you'll be asking are, what are the activities needed to support the woman and her family, to communicate concerns or issues? So what needs to be present in your organization, within the service specifically, what needs to be articulated so that all clients know that this is a safe space to disclose and talk about this issue. And then what tools and actions will staff use to identify intimate partner violence in their daily service encounters? And so through the WRAP workers training, resource guide, and all of the other information, we go into details about and offer resources and links to tools that you might want to highlight in terms of what tools you'll use. So, how will you identify warning signs? How will you screen, that kind of thing. So it's going to be important that you look at that initial stage and, who will be screened. And so perhaps your protocol will say that all participants, all clients will be screened for the potential of intimate partner violence, whether there are signs and symptoms that suggest it or not. Okay, and so you're going to want to really be specific about who's responsible for screening and the assessment. And then again, as I said, what are the screening procedures that will be used? Will that come from training, a document, a specific tool? That consistency is so important, so it's not left for an individual staff to decide, whether or not they're going to even consider intimate partner violence as being an issue that this individual might be experiencing. All right, and so then moving on in your protocol to the the responding phase, that's the next part that you may want to look at in terms of developing your protocol, and that's how we've sort of encouraged you to look at it. And so that's the real assessment intervention phase. And so moving from the screening and identification to now what's the actual intervention and response. And so questions you're going to be asking yourself in terms of what's going to be in that protocol is, what are the specific actions that staff will take when intimate partner violence has been identified or disclosed? Who will be consulted? What response is expected? What safety tools and measures will be utilized? Because that's the stage where, it's going to be very important when it's disclosure or something witnessed, how that person is responded to, what information they're given, what they're able to access, that kind of thing. And so those are some of the questions that you'll be asking yourself as you formulate that particular part of your protocol. And then, of course, as I said, there's going to be different responses based on, is this an immediate or a crisis situation? Are they in danger right now? If yes, what will you do? If no, then what will you do? And your protocol should also speak to, are there disclosures related to past abuse? Because your response then obviously would likely take a different direction, okay? And so you want staff to be very clear and the agency overall to be very clear on what we will do in an immediate crisis situation and what will we do, for situations where that person may not be an immediate crisis, but something needs to be done. What action will we be taking at that stage? And then finally, the referral stage. So what are the activities? What will need to happen? What will we need to outline in the protocol related to that stage where consultations are happening, collaboration is important, and resources are also key. So questions you're going to be asking yourself at this stage and at this part in the protocol is, what are the community linkages needed to serve clients and respond effectively in intimate partner violence cases? How will referrals be conducted and by whom? And then, of course, what follow-up or ongoing services will be offered? And so you're going to want to be very clear about, a referral will be made to, this particular staff will consult with. The action that we will take at this stage will be, and of course, differentiating again those different levels of safety and threat to a person. So what will the referral look like in situations of crisis and immediate safety concerns? What will referrals look like for situations where it's past incidents and obviously still concerns, but assessing that level and maybe consulting with where that particular client might be at. All right, and so looking further at this outline document, confidentiality. What are the key considerations and limitations related to confidentiality that must be established? So you're going to want to start to outline that. And again, pulling some from our protocol. And then you may also have some confidentiality procedures and expectations that you can draw on. How will clients be informed about confidentiality related to intimate partner violence? What they may disclose, and what might be witnessed, and who will do so? Who will inform clients about this? Who will be consulted, and that kind of thing. So confidentiality is an important one, particularly because there are some limits to that, as you probably are well aware. And so that section of the protocol should clearly describe the confidentiality standards and to clarify the roles, and you want to avoid misunderstandings and expectations related to what information will and will not be shared related to intimate partner violence disclosures, should they be made. Okay? And then documentation and reporting. So that section of the protocol will include, what information will be documented within the client file, how will the information be used, how are expectations about mandatory reporting shared with clients or staff, and who will make decisions about reporting. Okay. And the next section is an important one, legal considerations, obviously. What are the potential liability issues for your organization? What are the legal resources that might be needed by women who are refugees and experiencing intimate partner violence? So that's what you will be referring to in that section within the protocol. And then finally, the protocol review process. Well, not finally, but in terms of information to be gathered, protocol review process. How will you assess the implementation and development strengths and the weaknesses and make modifications as needed? Because sometimes, because it can be time consuming to actually, develop a final document. Sometimes it sits and it serves its purpose, but it's not reviewed and it's not modified. So it's going to be important that it's reviewed, it's possibly altered as needed. So whether that be at a management level or a committee or partnership level, the review process needs to be outlined, and perhaps there's some timelines around that. So in 6 months, this protocol will be reviewed, by whom, and what will be looked at, that kind of thing. Your protocol might close with, an appendix or some appendices, and so that will be the supplemental materials and resources that are included, referenced, and or integrated into the protocol activities. And so what are those documents, perhaps, that your staff will be referring to that are directly related to the particular stage, whether it be warning signs or safety assessment tools, risk assessment tools, threat assessment tools, those kinds of things. What are those things that form important parts of the protocol? And then any references or bibliographies that might be necessary. So what are the sources that are used? Where can support or reference materials be found? And so maybe there's some other tools that you might want to highlight. You may want to put the RAP Workers website as a tool of reference, within your protocol, or anything else that you may come across that you think would be important for your staff to have, for you to continue to refer back to. And so that's going to be very important that you have that as well. Okay, so let's now talk about getting started. It's one thing for you to be part of this, to get to a place where you understand why a protocol is important, or why it's important that you come back to it, and maybe you're reviewing it or revising it. Some of you maybe just starting the process. But, what do you do now? Because what we would hate to hear is that you've come this far and then, nothing happens from here. And so it's really important that you take it to the next, stage and actually get something in place. And so what we would encourage you to do is to share this information within your organization. So what are the notes that you took today? What are the handouts that you accessed? The RAP Workers website, information that was shared today. Take that back within your organization, have a discussion about it. Perhaps you're going to be the one, if you're not the one necessarily developing the protocol, but maybe you're the one that's going to now advocate for the protocol to be developed, or as I mentioned, you might be at that review or revision stage. So be that person who kind of advocates for this being a priority within your agency. Maybe you're going to create a planning or a development committee. So who are the people that are willing to come together to take this to its next and final stage? And so who are those people, and creating an internal committee. And then what works sometimes very well is to coordinate a community intimate partner violence protocol development partnership. And so sometimes organizations will come together with the the shelter that they refer to, or the local crisis service that's available, or housing, whatever resources are really key partners within your specific community. Perhaps your protocol will be something that you develop together as a partnership, and so maybe you're one to lead that, or to initiate that. So whatever you decide to do, it's up to you, but I really encourage you to start from where you are. Okay, so don't look at it as a huge, task in front of you, but that, breaking it down, and hopefully we've made it very easy for you. It can be a lengthy process putting things together, but you have the project protocol that you can rely on and you can pull information from. You have the protocol preparation, the key elements, that checklist, so that you know what are you pulling together at the beginning stage. And then you have the actual outline and sort of a fill in the blank of what needs to go into some of the most important sections of your protocol. And again, as I said, you're going to edit, add to, or remove what's not, relevant for you, but try to make it as easy as possible for you to really get something in place there. Because as I mentioned in the beginning, making sure that that women are safe, that children aren't exposed to, that partners are held accountable, but also, offered resources and services related to their behavior. There's liability issues to be considered, the community benefits when there is something clear in place, and staff, volunteers, everyone benefits when there's a protocol in place, because there's clarity. People know what they're expected to do. They don't feel unsure about what to do, because that's the number one reason, I think, and that's what came out of our focus group as well. People didn't feel equipped, and so therefore they either weren't responding, or they weren't feeling good about their response related to intimate partner violence. And so when there is something in place that's very clear and it outlines this is what you will do to screen, to identify in response to related to referrals, just people feel at ease to some extent. I know this is a topic that is not easy for many people. It's a topic that is very uncomfortable for many, but it is something that with the right information is easier to talk about and address. And so that starts with very clear policies and a protocol that outlines what's expected and what will be done so it's consistent across the board. It's not left for staff to decide whether or not they feel it's important. It's expected by the agency. So start from where you are is what I'm trying to highlight, okay? All right, so this is just a moment to, we won't be able to do this because of the number of people that are on the line and available, but I wanted this to be an opportunity to exchange knowledge. You all are out there doing the work at various levels, whether it be at a management level or some of you are direct service or, a middle management and supervisors. You're out there doing the work, and some of you have already developed protocols, have partnerships in place, have some important, ideas about where you're going with this. And so this is a great opportunity to share that with your colleagues, and share that within the sector so that the process is more consistent across Ontario, across the province. And when it's easier, then, there's more likely that it actually is going to happen. And so if you have information or if you are someone who would like further information that is out there and available, then, we'd like to be able to sort of offer this, not necessarily on an ongoing basis, but right now as we are looking at how to move protocol development further, how can we share the knowledge and resources that are out there? And so if you have additional tools and documents, further than what we've mentioned, we've provided, then please send that to us. We'd be happy to share that with your colleagues and those who are also, engaging in this process. Think about collaborating. We are now, as you can tell by being on this call, we're just a phone call, a telephone, computer away from being able to collaborate with one another. And, the opportunity to create maybe a partnership with someone who is also developing their protocol, but wanting some, some support and some accountability to keep the process going, that might be something as well. So please send any information. You can, let me know for now what information you have or need, and we'd be happy to share that with the various agencies, or you know how to get in contact with each other as well. So keep the communication open and exchange the knowledge that already exists. There's a richness that already exists out there, and so let's draw on that in this protocol development process as well. Okay. So questions. We do have just a few minutes left, and so, if there are specific questions about the information that's provided, then, I could probably answer a couple. Feel free to send others in to Rexdale Women's Center care of myself, or you can also send it to our executive director. And she'll certainly make sure that the right person gets it, or, here's an opportunity to ask questions that might be lingering. And for some of you, it might be that you are just taking in the information right now. And so there may not be any questions yet until you actually get started in the process. So if you have any questions, feel free to send those in the next minute or so that we have left. I'll be happy to answer any of those, and we'll look out for any that may come out in the near future related to this webinar and the protocol development process. So I'll just give you a minute to do that, and then um, I will check back. Seeing any questions yet? We'll give you just one more minute and see if there are any. Okay, so we're just looking for any questions that you may have before we bring this to a close. Okay, so I don't see anything in terms of questions right now, and I'm thinking that within this whole beginning stage, if that's where you're at, that you may not be at the point where you have questions yet. So as you develop it, there may be some things that come out, and feel free to let us know. Okay? So I want to thank you for joining us, and I apologize again. We had some technical difficulties at the very beginning, but thank you for joining us, and we really look forward to what's created through these processes. And feel free to share that with us. You know, how have you moved forward? What have you developed? If you're open to sharing that with any of your colleagues, we'd be happy to, help you with that, or, send that directly to other people so that they can, be helped along in this process. Again, the wrapworkers.com website is an excellent tool. If you haven't been there already, it's great. Training platform, resources are there, the protocol is there, the resource guide is there, all the training material. There are other documents there. These additional new documents will be added as well. So feel free to also let us know your feedback. What did you take from today? What did you enjoy about this workshop? How has it helped you, and how will it help you in the future as you move forward? So thank you again, everyone, for joining us, and I look forward to any communication conversations that we may have in the future. So take care, and we'll say bye for now.